The damage being done to many hospital services in England in the wake of the pandemic is exposed by new NHS figures. More than 4 million patients are now waiting for routine surgery and treatments. Nearly half have been waiting for longer than the official target of 18 weeks. And doctors are warning that a second wave of the pandemic, especially during the winter months, could make things even worse. In fact, more than 110,000 people in England have been waiting for treatment for more than a year. That's the highest figure for 12 years. More than 20,000 cancer patients did start treatment in August, but that's a reduction of 5,000 on the same period last year. And hospital admissions for COVID are still rising, and they've doubled in the past 2 weeks across England. Our health editor, Hugh Pym, reports from a hospital in Bournemouth, which is preparing for the challenges ahead.
8 in the morning and the pressure's already on at the Royal Bournemouth Hospital.
OK, next patient.
Any idea people are staying away from A&E is a distant memory.
She has regularly self-harmed over the last couple of years.
All the bays filled up overnight. Now comes the staff handover.
So she is a 24-year-old lady, again known to the mental health team, who had a crisis last night.
Irrespective of COVID, hospitals like this are facing up to the build-up of the usual winter pressures. Here they've seen some of their busiest ever days in the emergency department. Dr. Farhad Islam is a senior consultant here. He's seen an increase in patients needing mental health crisis care.
It might be a call for help, might be a psychiatric problem, might be a self-harm patient, a person that's got mental problems, mental health problems. So, we're seeing the whole array of patients, but in amongst that, the rate of COVID is increasing.
COVID case numbers are relatively low in the local area.
So I think the goal today was to try and clear another bay if possible.
But at this meeting they need to work out how to make space while protecting other patients.
We do need to get another bay empty, I completely agree.
We're still seeing numbers of patients come in with non-COVID related conditions, but we've got a small proportion of patients with COVID and we are unable to mix those pathways, so we need to find a way to do that safely.
So this is our intensive care unit that we have ready to use for the second surge of COVID.
At the peak there were 20 patients in intensive care here, half with COVID. They've got room for more if needed.
So we're all still fairly raw from last time. We're very used to having family members on the intensive care unit, and to suddenly be told that we can't see those family members and they can't see all the work that goes into helping their loved ones was very difficult for the staff. And that anticipation of having to go back to that is quite traumatising for critical care staff.
So can you just take me through what we're doing? So we're actually going to be doing a double ward refurb over here, which is the first time we've done this.
Elsewhere they're preparing for the usual winter challenges, creating a frailty unit to help the recovery of elderly patients and their safe return home.
Okay, so you've been seen by our nursing team, and you've been seen by our surgical team.
Some patients like Christopher are coming back in for non-urgent operations.
I'm having reconstructive surgery subtalar.
Christopher's ankle operation was postponed in March. He's pleased it's now about to be done, though the wait's been difficult.
Quite a lot of pain. I'm on quite a lot of heavy dose painkillers. It's difficult to walk really, because I'm putting a lot more weight on my other leg. Yeah, pretty tricky.
I asked the chief executive how they were tackling the backlog of operations put off because of COVID-19.
We've been going through all the long waiters and really trying hard to get people who've been waiting longer. None of us want that for our friends and family, and none of our clinicians want that. Everybody wants to treat patients. We know how awful it is when people have to wait a long time. So it's a top priority.
During the first surge, much of their focus was on the sickest COVID patients. But now there are other worries as well.
If we see a flu season, if we see COVID rising, and how we balance that with keeping all the other patients who need to be treated in hospital coming through in a timely way, that's going to be the biggest challenge.
It'll be tough for staff, some still exhausted from their efforts earlier in the year. But they all want people to know they're there and ready to help patients, whatever their needs. Hugh Pym, BBC News, Bournemouth.
So let's take a look then at the official figures, and they show a significant rise in new infections. 17,540 were recorded in the latest 24-hour period, and that is up from just over 14,000 yesterday. It means the average number of new cases reported per day in the past week is 14,520. Hospital admissions, as we said, have jumped significantly. On average, 528 people were being admitted every day over the past week. That number does not include Scotland. 77 deaths have been reported of people who died within 28 days of a positive COVID-19 test. And it means on average in the past week, 56 deaths were announced every day, which takes the total number of deaths so far across the UK to 42,592. So now that we've seen those figures, let's talk to our health correspondent, Lauren Moss. We mentioned the new cases, Lauren, and of course this issue about rising admissions. So let's take stock. And what's the picture tonight?
Well, hospital admissions, if we look at those, they're an important indicator of the scale of the pandemic, because they show really how many people are seriously unwell with coronavirus. And if we take just England alone, more than 500 patients were admitted to hospital on Tuesday. Now, approximately 3,000 are being treated in total, but to put that into context, at the peak of the pandemic, there are about 3,000 new patients being admitted every single day. And the numbers are varying across the country. The North West, the North East and Yorkshire and the Midlands have greater numbers in hospital compared to, say, London and the South West, for example. And today we also got the latest figures for test and trace in England. So these figures are up to the week of the 30th of September. And one of the important things to look out for here is the test turnaround times. And we have a graph that we can show you now, which will show that by July, when we look at those figures as they come out, which show when people are going in person to get their tests. So that's going to a test centre. The test turnaround times in July were around 24 hours for those results coming back. But over the last 6 weeks, they've slowly declined. And in fact, the latest figures show that just a quarter were returned within 24 hours. And 24 hours is the target. And time is critical with this to limit the spread of the virus and also to contact those who potentially may also have it. And NHS representatives are saying that both of these are big issues right now.
OK, Lauren, once again, many thanks. Lauren Moss there, our health correspondent.